Okay. It's Tuesday's tip with Dr. Britt.
We're discussing spinal decompression this week. I have two really good research articles that show that decompression will help with low back pain. It can help with disc height, disc hydration, and help with some of the issues that you develop with nerve impingement, which is either have the disc touching the nerve or you have canal stenosis or spinal stenosis, which is where just the narrowing of the hole that the nerve root comes from. I personally like the spinal decompression. Traction is similar, but for me, this is one of the reasons why I bought this practice, is that this piece of equipment was in here. It works on a 28-minute cycle. What it does is it creates a wave and a vacuum effect inside the disc and the vertebrae. It pulls them apart and eases them back in. So it helps hydrate it a little bit, helps create that space in the disc area, helps create space in the foramen, which are the holes where the nerves come out. The two studies we have show that it does help with pain. It does help with that numbness, tingling, and weakness. The other one shows that if we actually do what we already do here in this practice, soft tissue, and we do spinal adjustments, we do soft tissue therapy exercise, and then decompression, we actually get a little bit of a better result from that. These are 28-minute treatments versus which traction, because there are people, what's the difference between traction and decompression? Traction is typically run a little bit shorter, a couple times a week, maybe 10 to 20 minutes is what the majority of the protocols that I've seen, versus 28 minutes. You're hanging out on this, and it, like I said, it creates that spacing and creates that vacuum effect inside the disc. I bought the practice mainly, and a large part of it was because this was in here, and when I had an initial back injury years ago, I wish I'd had this. I'm dealing with one now, and if you've come by or watched our Facebook page, you'll see pictures of me on this. This shows that it will help with prolapse. It can help with herniation. There's still some research going both ways on that, but it's cost effective. It is super conservative, and it does show to work. So if you'd like to give it a try, give us a call. I mean, you might not be a candidate for it, and if you're not, we will tell you. So that's Tuesday's tip with Dr. Britt. We help you move better, live better, feel better, pain-free.